Senate Republicans are looking for a plan B on the debt limit. Under a plan floated by Minority Leader Mitch McConnell, the president would be able to increase the debt limit over time by $2.4 trillion. The catch here, he would have to cut spending even more. The offer comes as talks continue to slog along. For some perspective on why this is so hard, Darren Gersh looks at why spending for entitlements like Medicare is both extremely popular and a target for cuts.
Any program providing health care for 48 million people will be complicated, but Medicare's financial problems can be summed up with a few numbers. A decade ago, spending on Medicare was a relatively modest $222 billion. By 2010, that had more than doubled to $523 billion. And that is projected to almost double again to $923 billion by 2020. Dr. Mark McClellan ran Medicare under President George W. Bush and says its rate of growth is just not sustainable.
Our healthcare costs are growing at a rate much more rapid than our overall economy, and that means that any real effort to address the federal deficit must address spending on the Medicare entitlement.
The deficit talks in Washington change minute by minute, but federal healthcare spending might come in for cuts of around $350 billion over the next 10 years. Advocates for Medicare say the president's Health Care Reform Act already targeted $500 billion in Medicare cuts. Max Richtman at the Committee to Preserve Social Security and Medicare says that's enough.
Slashing Medicare, which is what is being considered now by some, without also addressing overall health care costs and health care inflation across the board, will not solve anything. It'll just squeeze Medicare beneficiaries.
Democrats have pushed for Medicare savings that force providers to change the way they deliver care, rewarding quality over quantity. Republicans come from the other side, arguing for reforms to make Americans more cost-conscious consumers of health care. McClellan says any solution to Medicare's funding will have to do both.
We need to change the way that Medicare pays doctors and hospitals so that they do get paid more when they take steps to keep people healthy and avoid unnecessary services. We also need to give Medicare beneficiaries an opportunity to be more effective and powerful consumers of health care.
Given the white-hot political risks of tackling a long-run reform of Medicare, analysts expect a big agreement to reduce Medicare spending won't be reached until after the presidential election. Darren Gersh, Nightly Business Report, Washington.